Welcome back. You're still watching Beautiful Day. This is Weather HQ. Now, around 1 million Filipinos are now living with dementia. This, according to the Department of Health. Now, many still think memory loss is just a normal part of getting old. But experts warn that dementia is a serious condition that affects not just the memory, but also mood, behavior, and your daily life. Now, to help us understand that better, we're joined via Zoom by Richthofen Toffie de Jesus, a psychometrician and clinical psychologist from East Avenue Medical Center and the Dementia Society of the Philippines. Good morning, Toffie. Welcome back to the show. Thank you so much for joining us.
Hi, Paolo. Good morning. And of course, good morning to all of our viewers today.
Now, we mentioned it a while ago. DOH says that there are about 1 million Filipinos, give or take, who are now living with dementia. When we take a look about how this concerns our country as a whole, how big is this dementia in terms of the way that it affects our countrymen?
Well, primarily, it has a very big impact on our society because as what happens, for example, for people with dementia, they now become, of course, a certain task that needs to be done by their family, maybe perhaps even a challenge that needs to be fulfilled by their families. So, of course, for people with dementia, they will be facing deterioration of their cognitive abilities as well as an inefficiency in their activities of daily living. So, one way or another, it will be really giving a cost to their families to take care of them in their everyday lives. So, it is something that we really need to be more knowledgeable about so that we can understand and we can also give a proper response whenever this will happen to our family members.
So, Taufiq, kapag pinag-uusapan yung dementia, sinasabi nila na minsan it's just memory lapse or hindi talaga siya dementia or may konting denial na talagang it just happens with old age. What is the difference between yung normal memory lapses and, of course, diagnosing dementia?
Okay, first and foremost, even though we go into our old age, we are still capable of having cognitive effectiveness. So it doesn't mean that getting old, automatic we'll go and have dementia. It's not like that. Not to mention, dementia is an umbrella term, which means that it encompasses a lot of different psychological and neurological disorders. Okay? When you talk about dementia, it means it is a general deterioration of your cognitive and daily capacities. Alzheimer's disease, for example, is just one example of dementia.
Mhm.
There are still other dementias that can happen. Now, the difference here is that the deterioration in dementia is much faster. So you will notice that the changes in the behavior, in the activities of daily living, in the cognitive capacity becomes more pronounced. It's more prevalent. So, for example, for an 80-year-old without dementia, you might have certain lapses from time to time, but you will notice that you're able to retrieve whatever it is you're trying to remember after a few minutes. But for people with dementia, it is already a difficulty that's more pronounced, more consistent, and it's getting worse as time would go by. So that is why it is very important for our Filipino viewers that if you are noticing something with your family member, it is important for you to consult your neurologist, your geriatrician, your psychiatrist, so that they can then start the evaluation. The neurocognitive testing will be done by your psychologist so that we can identify which specific kind of dementia is present within your family member.
Are there early signs that people should watch out for? Because some people obviously have it diagnosed. It's a bit too late in terms of maintenance, in terms of prevention. What can people do to have an early indicator or at least watch out for?
Okay. Risk factors for dementia would include number one would be age, because primarily as you get older, the higher the chances of you having it. At the same time, you need to control your vascular risk factors. So, for example, people who had a stroke, they are more at risk of having dementia. And then, of course, those people who are maintaining certain illnesses like hypertension and diabetes, again, those are risk factors as well in developing dementia. Falls can also be a risk factor. So whenever these things are happening with you, you need to understand that these are now the things that can lead you to the development of this kind of condition. So therefore, you need to really get yourself checked at least once a year so to ensure that everything is still working well.
I think a lot of people are surprised to know that when you talk about dementia, it is an umbrella term. As you mentioned a while ago, Alzheimer's, I believe, may be the most common type. When you
Yes,
look
yes.
at the different types of dementia, what are the ones that you typically encounter dito sa Pilipinas?
Yes, of course. The top three would be, of course, your Alzheimer's disease, which is the most prevalent one, followed by major neurocognitive disorders due to cerebrovascular accidents. So these are the dementias due to a stroke.
Mm-hmm.
And then, of course, you have your frontotemporal dementia as well.
Mm-hmm. And of course, I believe another term that has been moved about is yung Lewy body dementia. I believe is
Yes,
another one that
but
has
that's
been more
less
common.
common. That's
Okay.
quite less common. So, una yung tatlo. You have your Alzheimer's, your vascular, and then your frontotemporal. Your Lewy bodies kasi, what happens here is that there is a specific entity within the brain known as the Lewy bodies that's not found at most cases naman that we have with dementia. Now, the thing that you can see with Lewy body is that there is hallucinations that are happening within the individual. So, for example, if you have an elderly that is usually telling you things like he is seeing things that are not even there, then that would be a good sign that that may be a Lewy body dementia.
Mm-hmm.
At the same time, there's also behavioral changes that are coming first as compared to the cognitive ones. Unlike with your Alzheimer's, the cognitive capacities are the ones that first suffer.
Mm-hmm. I'm sure there are a lot of people now concerned about all of the different types of dementia, all of these risks. Let's talk about prevention. And of course, let's talk about ways that lifestyle factors could potentially diminish the risk of developing dementia. First of all, are there any lifestyle changes that can be done to reduce the risk of developing dementia?
Of course, primarily what you need to understand is that heart health equals to brain health. Researchers would say that people in their 40s and in their 50s who took care of their vascular risk factors, meaning you took care of your heart, you ensured that you have a good diet, you did not have any stroke, you have your hypertension controlled or maintained. These are the people who then get a lower risk of developing dementia along the way. However, for example, if let's say you are smoking, you are drinking, your typical lifestyle problems, if these are prevalent in your daily living, then of course it also increases the chances of dementia. At the same time, we need to understand that there is a factor known as cognitive reserve. This means that you are stimulating your brain in order for your neural cells to have multiple connections to one another, therefore strengthening the bond and the communication that they have with each other. So that's why, if for example, as you age, you have what we call apoptosis or the natural cell death, the cells that die out will then be compensated by the cells that remain. So if, for example, you engage in cognitive stimulation activities like reading, for example, doing puzzles, ensuring that you keep yourself current with the news. So whenever you allow your things to be cognitively active with your daily functioning, then that is a protective factor towards dementia.
Ako, staying active with the news, nakaka-stress din yun eh. But then, of course, reading the puzzles, I'm sure, would definitely help. Toffee, when we look at those who are diagnosed early on in terms of maintaining or rather managing any dementia that they might have, what are the normal orders? What are the normal treatments and interventions that can be used to treat that and, of course, be able to manage that?
Okay, first and foremost, let's try to focus on Alzheimer's for this particular case. If your relative, for example, is diagnosed with Alzheimer's disease, then the first thing that will happen there is that your doctor will be prescribing medication for that. The medication will then allow for certain chemicals, for example, like acetylcholine, to be in more proficient amount within your brain. So that allows you to ensure that there is a proper memory functioning. Now, the acetylcholine, once it's properly maintained in the brain, can then at least buy you around 5 years of a maintained capability.
Mm-hmm.
Although we need to understand that there's no cure yet for dementia. Okay? Now, as time would go by, you will still get worse, and other medications may be added onto you. A lot of doctors are now actually maintaining two medications. They do it at the same time to ensure proper functionality within the individual. So besides the medication, there are a number of therapies that can also be done. First, we have what we call cognitive rehabilitation. So that means on a weekly basis, the patient will go to the doctor or the psychologist, and the psychologist will then administer activities that stimulate the brain. And therefore, by doing so, you are then allowing the remaining neurons to connect with one another so that they could at least maintain a certain level of functionality. This will then be succeeded with a series of activities that you'll be taking home so that you can also practice even though you're not with your psychologist. So besides that, there's also what we call reminiscence therapy. where in which you can then dig up old albums and try to recall who is this person, where am I in this activity, what am I doing in this picture. So by doing so, you're trying to help recall certain things that happen within your life. Now, in addition to that, exercise, physical exercise will be very essential. So as long as our patient is capable of moving, we are recommending light exercises to ensure that the body remains active as well.
Mhm.
So whenever you do this kind of regimen, you are then ensuring that whatever is the current status of your patient will then be maintained on a prolonged basis, and we can then delay the progression of the illness.
What advice you normally give families who are dealing with loved ones with dementia, considering that it can be difficult, it can be stressful, especially on the finances and, of course, yung level of patience that these families normally have to be able to really care for one of their loved ones with dementia?
Yeah, actually, we need to understand that the caregiver burden for dementia patients is very real, especially because they could be very repetitive. They can sometimes develop behavioral problems such as agitation or even aggression. So it really takes a toll on the caregiver. So the first thing that we usually tell them is that they need to have a support group. Okay, if there is a possibility of joining online groups for people who are also taking care of their relatives with dementia, that would be a good step, because that way you can then exchange the way that you do practices regarding taking care of your relatives. They could then exchange strategies that they could employ, and at the same time, there would be a good outlet for them. If you have a chance to undergo clinical psychotherapy from your psychologist, that would also be okay, because your psychologist can then give you the proactive methods in how you can try to maintain your level of stress and maybe perhaps process some of the grievances that you might have, given the fact that you're taking care of somebody with an illness of dementia.
Mhm.
At the same time, we're also telling them that, you also need to keep yourself active with your physical activity, even your cognitive activity, because sometimes the repetitive task of taking care of somebody with dementia may also contribute to your own personal deterioration. Okay? So whenever these things are being maintained by the caregivers, more or less they're able to be capable of managing the stress on a more productive level.
So, Toby, when we take a look at the state of how we treat patients with dementia and, of course, supporting their families here at the moment, how would you rate how we do it here in the Philippines in particular? There are more communities, there are more people trying to address this for sure. But how would you see the way that we do treat dementia here in the Philippines at the moment?
Actually, it's very optimistic, Paolo. Because of certain organizations such as the Dementia Society of the Philippines, for example, the efforts being done by the professionals within these organizations are already bearing fruit. Since 2002, this has been the advocacy of the Dementia Society of the Philippines, that we would like to educate people at the grassroots level of understanding what dementia is all about. We are advocating that dementia is a disease and therefore it needs to have medical attention. We are advocating that memory loss is not just simply a sign of aging, and therefore there is still even functionality despite the diagnosis of dementia. And I think it's bearing fruit nowadays, because more and more hospitals, both private and public, have memory centers. So before it used to be just three hospitals, but now even outside Metro Manila, they are now doing this. So I think there is a good chance that we are developing a better, more efficient way of handling this. And I think, given the fact that you, as the media, are giving attention to this kind of situations, it then helps the advocacy. So I think for our viewers today, I would just like to share that if you are having a relative who's already above their 60s or above their 70s, we need to understand that their cognitive health is something that is we need to give attention to. Maybe perhaps you can have your elderly relative to be checked at least once a year to ensure that their cognitive health is still within the normal level. And if it's not, if it's already deteriorating, you need to understand that you don't need to lose all hope. You need to understand that dementia is a manageable condition, and you just need to work with your physician and your psychologist in order to make things better for your patient as well as the caregiver.
So, Tofi, for those who want to reach out to you and your organization, especially those who are worried about dementia or are struggling dealing with it, how can they reach out?
Yes, the Dementia Society of the Philippines can be reached at dsp.org. We are available online. We are then willing to answer any of your queries that you might have regarding dementia and dementia care. We will also be having our national convention on October's 1 to 4. We will be in Calasiao, Pangasinan for that. And at the same time, for my practice, I am available at East Avenue Medical Center.
Ladies and gentlemen, he is Toffie De Jesus, a psychometrician and clinical psychologist from East Avenue Medical Center and the Dementia Society of the Philippines. Toffie, thank you so much for joining us, and hopefully more and more people reach out to you very soon. Maraming salamat.
Thank you, Paolo.